In today's short video, I'm going to discuss the surprising connection between the heart and the thyroid and the importance of looking at things with just a little bit of a different perspective.
Hello. I'm Dr. Dave McCann, chiropractor and stress hacker. It's time for another installment of For Your Further Information.
FYFI, for your further information, in case you didn't hear me the first time.
Where I answer your frequently asked questions from a different perspective. Let's go.
A couple weeks ago, one of my longtime patients, we'll call her Emily, came in for an adjustment. Emily's 43. As I said, she's been a patient for a while. She's a mom, she's a teacher, and she also said that she had been having some heart palpitations. It was really kind of making her anxious and affecting her sleep, affecting her ability to work and to be a good mom. And she was obviously concerned about this. She had already been to her general practitioner, who recommended that she get what's called a Holter monitor, which monitors your heart rhythm over like 24 or 48 hours. And I said, well, why don't we go ahead and order some labs and see what else might be going on that could be at the heart of the issue. Emily got back the email response, and I'm reading from Emily's email from her doctor. She says, the heart monitor shows PACs, which are premature atrial contractions. These are extra beats of the atrium of the heart when it contracts, causing heart palpitations. If this is bothersome, please consider prescription for metoprolol, 25 milligrams, 1 tablet daily. And Emily went on to say, I'm not really sure what to make of this, but it seems like the medication is to minimize the palpitations and not really address the root cause of the issue. And Emily is 100% right there. So when we got her labs back, we sat down and took a look at them together. It turns out that her thyroid was running really hot. And I said, well, this is kind of no big surprise here because the thyroid, which sits right here in your throat, sets the body's metabolism. And it can be too high or it can be too low. But here's how and here's why it impacts the heart. Well, one of the things we know is that there are 3 very important minerals, among other things, that play a big role in normal cardiac and normal thyroid function, including potassium, sodium, and magnesium. Well, it turns out that the prescription that she was offered actually reduces the sodium uptake and slows down the potassium release, but when we looked at her labs, turns out that magnesium was really the big player here, making it hard for the system to relax and to calm down. Well, once we made some recommendations for some calming thyroid support that included a little bit of kind of a higher dose of magnesium, her symptoms very quickly started to subside. So we're going to continue to monitor and test, and we'll make adjustments accordingly. But the important thing here is that nothing happens in the body without a reason, and you have to look at the whole system to see what's going on. She could have chosen to take the medication and just cover up the symptoms, but instead she asked the very important question of why. And with that, we're able to get to the root of the problem. I hope you found this helpful. If you've got any questions, please shoot me an email at Dr. Dave McCann, info@drdavemccann.com. Check out my website where I've got some other videos on labs and how they can impact your health and what you can do about it. Share this video with somebody that you care about. Thanks for watching. I appreciate your time. I'm Dr. Dave McCann. Cheers.